Good afternoon. I'd like to welcome and introduce Dr. Robert Murphy, Executive Director of the Harvey Institute for Global Health, and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine, who answers your COVID questions every Tuesday and Thursday. We're doing it a little different this week on the Harvey Institute for Global Health's Facebook page. Today, Dr. Murphy will be answering viewer-submitted questions and addressing the latest COVID headlines through today, the 18th of May. We invite you to submit your questions via Facebook at NU Institute Global Health or by email at globalhealthinstitute@northwestern.edu. Leading the discussion today is myself, Sevi Jakowski, who's a student research assistant with the Institute. So Dr. Murphy, I'm going to start with some updated COVID statistics.
Thank you.
So in the United States, we're seeing a massive increase in cases. Yesterday, we saw 134,102 new positive cases, with our 7-day average peaking of 100,000 positive cases per day. This is a 61% increase over the last 14 days. Hospitalizations are following with an increase of 27%. And fortunately, we are seeing a decrease of 7% in deaths. In Illinois, yesterday, we saw 5,292 cases, but 2 days ago, we saw 16,000 new cases in Illinois. And cases are going up by 57%. And like the rest of the country, hospitalizations are increasing, but deaths are decreasing. And Illinois is seeing about a 6,000 positive case average every 7 days. What can you tell us about what is going on with these positive cases spiking so much right now?
Well, it's multifactorial that we are, number one of the least vaccinated major wealthy countries. So that is part of the problem. We also are the least boosted countries. In other words, even the people that have been vaccinated have not had the booster. Some 70% have not had it. So, our uptake, so that's one thing that is driving this thing. The other is that we've really loosened the mitigations up everywhere since the end of February. And that, of course, is fueling, the whole increase in the number of cases right now. The good news is that there's enough people with immunity and there's enough people vaccinated that the death rate is still hasn't changed very much and is very low. So some 300 or so people per day, I think, on average in the country. There's been a few small upticks, but we're down at a level that's I call it like one plane full of people dying per day. But remember, we had thousands of people dying per day. So hospitalizations are, although the cases are up, they had been very low. So the healthcare system is not stressed out like it was during the Omicron surge. So it's we're just going to have to live with it this way. There are many things we can do. Many states have brought and cities have brought back indoor mask requirements. We have the test and treat strategy that the White House has recently been promoting. The system isn't quite there yet, but some places it works, some it doesn't. This is where you can actually go get the drug without having to see a doctor. That's the goal, but it's a little bit bumpy. You can always get the medication through a physician or going into a clinic. There's no charge for the medication if you're one of the eligible people. And keeping in mind, eligible people, anybody 65 and over, anybody over 18 with an underlying medical condition, and that's a very broad list, and even people over 12 who have an underlying medical condition that qualifies if they weigh at least 88 pounds. So a lot of people are eligible for Paxal or molnupiravir, but Paxal works better. So we have all those things that we can do. There's monoclonal antibodies as well. And if you end up in the hospital, there's also much better treatment.
That's wonderful to hear. But, one of our big COVID headlines for today that was published in the New York Times is how often can you be infected with COVID? This is a good story as a segue to the numbers we just saw.
Well, we saw people get Delta in December and they got Omicron in January. So yeah, there's two within a 30-day period. It looks like if you've had Omicron, so if you've gotten sick since the beginning of this year, you most likely had some variation of Omicron. And that is protecting you, at least for a few months, against getting Omicron again. But remember, all that immunity wanes, at least the protective part from getting infected. It's still probably keeping people out of the hospital and keeping people from dying.
Wonderful. And now for a second big headline, coronavirus cases proliferate, especially in the Midwest, as the US death toll nears 1 million. What can you tell us about, this huge spike, as I just said, 16,000 positive cases 2 days ago in Illinois?
It really is just amazing what's happening. And the drivers are all the same, loose mitigations, unvaccinated people losing their immunity already from the COVID that they already had. There's nothing really magical here, except for the fact that the new variants are so highly transmissible compared to the old variants.
Yeah, absolutely. And now for our last big headline is that Europe is dropping mask mandates for flights and airports, loosening their COVID rules further. What can you tell us about what's going on in Europe?
Yeah, actually, I'm in Europe right now. I'm in France, and I'm watching really daily as the mask mandates are being lifted. It's a little bit different situation over here in that the proportion of people who are vaccinated is really high compared to the United States. And so they've kept up with the vaccinations better than the United States has. And they feel comfortable here now lifting these mask mandates, and people are out. And in the summertime here, a lot of people really spend quite a bit of time outside, and they're eating outside. They go to museums, but the museums are very big and airy. And they're not in close confined spaces like they are in the wintertime. So it's hopefully the seasonality will also help them here. But yeah, it's happening here too.
Yeah, it's very true. And this goes right into our first COVID question is, if someone vaccinated and boosted had COVID around Easter in the Chicago area, which variant they most likely have? Also, what is the risk of contracting any Omicron subvariants circling around, if any, in the Chicagoland area right now?
Yeah, well, there's people that are monitoring this very closely. We still don't monitor variants as much as like the United Kingdom does and other countries, but we have an idea what's going on. Around Easter time, it was all probably BA2, BA2 1.121. One of those Omicron variants most likely are one of the ones that somebody had. It really doesn't make any difference. The treatment is the same. The behavior of the virus is pretty much the same. It's not as severe as Delta, but it's more easy to transmit.
Wonderful. And now for a second COVID question. Does Paxlovid work in vaccinated individuals?
Good question. It's a logical question, but Paxlovid works completely different from how your immune system works. It's an antiviral drug. So it doesn't matter if you're vaccinated or not, it works. It decreases the amount of the virus and it decreases the severity of the disease, almost like the effect of a vaccinated versus unvaccinated person. In the original studies of Paxlovid, which was before Omicron, so it was like even with Delta, it was a 90% decrease in hospitalization rate. So, now we're seeing people even vaccinated, if their immunity has waned, they can end up in the hospital. So if you're eligible to take Paxlovid, you really need to take Paxlovid, whether you're vaccinated or not. It works.
Great. And now for a third headline, what is the GSK COVID vaccine and does it work?
Yeah, it's just a different type of vaccine. It's a mixture, I think, with Sanofi and GSK working together. And they showed that they're having very good results with this. And purportedly, it's approved in some places around the world, but not in the United States yet. And so we'll see. So it's just going to be another alternative. The same is true for Novavax. It's another one that's approved in multiple countries, but not in the United States. And so we're going to see other vaccines. These technologies are very different from the mRNA technologies. So it's more a typical type vaccine, more standard development process.
Wonderful. Now our last COVID question. I'm most concerned about catching COVID in Mexico. What is the best timing for getting my fourth booster to help protect myself? Is there anything else I can do to boost my immunity?
I think if everybody's going to travel to a lower middle income country, that they should absolutely be up to date on their vaccination status. So if you're going to go to Mexico, you're going to go to the Caribbean, you're going to go to Africa or Asia, you really need to be up to date on your boosters. And right now the booster is just the same old one you had before. With Moderna, it's half the dose. But get up to date on your boosters before you go anywhere. And if you have a bad immunocompromising condition, you might want to think twice before going anywhere.
Yeah, absolutely. Well, Dr. Murphy, those were all of our COVID questions for today. And I believe we will catch you guys. Yeah, please.
Another little news item, which I think
please.
is important, is that it ties in what we were just talking about with the boosters, and that the Pfizer booster for 5 to 11-year-olds actually was approved. Remember, they had only been approved for their first 2 shots. So it's a very low dose of that vaccine. And very few people in that age group have actually taken it. Only 29% have had 2 doses of in that age group have taken it. But it does decrease the amount of Omicron that kids get. So the boosters are now approved. So keep that in mind for kids as young as 5 years of age.
That's really good news, and will hopefully help with the surge that's going on. Well, Dr. Murphy, those were all of our COVID questions, and we'll see you guys probably on Friday this week.
Okay, great. Talk then.
Thank you.
Bye-bye.